tobacco use is widespread in our population. The national prevalence for people with, for example, schizophrenia is an 80% smoking rate, and that's pretty much what we see here.
You know, tobacco is an addiction, and that's the key. That's very important to remember. It's not just a bad habit, but tobacco is an addiction. Nicotine is very addictive. It's as addictive as cocaine and heroin.
When I was in residency, I had a staff member tell me, there's a senior staff member say, you know what, schizophrenics smoke, that's the only way, that's the way of the world, nothing you can do about it. I think that is an old-fashioned way of thinking, and it is simply not true.
The things that we've been doing in the general population to help those individuals quit smoking hasn't worked with this population. So I think that's why we see a larger number still continuing to smoke, and we don't see a change in the smoking rates in this population like we do in the general population.
The people who run the programs are pretty smart people. They know this is a problem. They know the statistics. We've been talking about it a long time. So I kind of come from an issue of what would motivate them to really begin to think how they implement these programs that are client-centered versus regulatory-centered.
I think that to implement any type of tobacco protocols and be able to sustain that, it is a difficult thing, but it's important. There's so much help that's out there at the state, the local, even the federal level for tobacco cessation, and yet people aren't aware that there's a resource out there that can help them quit. And so by implementing and maintaining those at the local level, you can educate people and your consumers to be able to get that knowledge and take that first step to being able to live a healthier life.
But I also think providers feel like it's not really their role, or maybe it's not their job, or maybe, and I think the other biggest barrier is that providers feel like their clients don't want to quit.
I think the staff felt that it would impact the clients negatively if they quit. And there's a lot of myths about that if folks stop smoking, their symptoms will get worse, and that it'll be harder to treat. And that's been proven that that's not true at all.
We know that people that do smoke and have a mental illness tend to have poorer outcomes and more hospitalizations and need more mental health treatment. However, if they do quit smoking, their outcomes improve quicker.
And I just think it's an education thing as much as anything, to educate people, and it's the same. They need support, they need education, and just to keep working on it.